Hi everyone. We're gonna present our nursing theory today on how gossiping affects nursing care and the nurse-patient relationship. So myself, Brooke Swanson, McCall Fleming, and Trisha Christensen put this together. So first, we'd like to talk about the phenomenon that led to our nursing theory. So gossiping is something that has become more and more common among nurses. I'm sure many of us have experienced it in our nursing practices, clinicals, um, on the job site, you name it. We've probably heard it. And it's not an activity that we should necessarily be participating in as nurses. Feeling frustrated at work, it is inevitable, but it becomes a problem when those frustrations turn into gossip and then we start to degrade our patients. And it tends to negatively impact the patients even if they do not hear it. And in turn, that negatively affects nurses and the care that we are able to give for our patients. So this theory that we came up with about gossiping, we believe that this theory is a mid-range theory because there are specific actions and steps that can be followed to improve nursing care and our nurse-patient relationship. We can do this by understanding how gossiping can negatively affect that relationship and the care that we provide our patients. This theory is focused more narrowly on communication and more specifically gossiping, which is a negative form of communication. To more fully understand our theory, we came up with 9 assumptions that will hopefully help you guys understand our theory a little better, and I'll expound on some of these as they come up. So number 1, we decided to kind of first off address the definition of gossip in a way. So gossip is idle talk or rumor, especially about the personal or private affairs of others. So it's good to just know what we're talking about and what we're referring to when we say gossip. Number 2, one of the fundamental principles of all communications is trust and respect. This is no matter where we are, with whether we're at home, whether we're in the nursing field, trust and respect are going to be the basic principles of a relationship, and um, communication is how we relate those. Number 3, in healthcare, the nurse spends the most time with the patient, so a positive relationship has a great impact on the patient's experience and sets the tone for overall satisfaction. It is vital for nurses to build trust with their patients. So once again, we're relating this trust with positivity, and this positivity and trust is impossible to accomplish if we're constantly talking negatively about patients. Number 4, gossiping about our patients causes nurses to feel more negatively about the patient. So like I just mentioned, um, whether we recognize it maybe completely or not, it will give us a negative feeling about our patients if we could continue to gossip about them. Number 5, talking poorly about patients can create biases within patient load the nurses have. So if there's, a patient that is easier to handle compared to another nurse, compared to another patient, we may be spending more time in the easier to handle patient's room, creating these biases, which will affect our care that we provide. Number 6, there can be no curing without giving our best care, and we cannot give our best care if we constantly talk negatively about our patients to others. Sounds pretty straightforward. In order to be the best nurses we can and provide the best care that we can, we need to, get rid of that negativity, specifically getting rid of the unnecessary gossip that goes on in the nursing field. Number 7, nurses and medical staff will never know exactly what is happening in a patient's life and why they are the way they are. I think this one's really important that we kind of key into. We don't know why somebody's coming in so frequently. We don't know, why they're dealing with what they're dealing with. We don't know what kind of backgrounds they came from. We don't know what kind of days they've had. We don't know how they're perceiving pain, and so it's hard for us to slap a judgment on them because we really don't know exactly what they're feeling and what they're going through. Number 8, all patients should be treated with respect and given the same quality of care no matter what circumstance they may be in, no matter how their attitude is toward their caregiver. And this one's really hard. It's hard to be able to give that mutual respect when we may not be feeling that respect from our patients. But in order for us to provide the same quality of care, we need to respect our patients in a same or similar way. Number 9, negative thoughts and words said about the patient will negatively affect nursing care and could potentially cause harm to the patient. So like we mentioned before in the introduction, um, taking care of patients is important, and we don't want to cause this harm. So in the end, our biggest goal is to care for our patients, and the way we care for them is to, decrease this negativity in the workforce. In choosing a theorist of influence, we decided to go with Virginia Henderson's theory. You can see her on the right there, looking great. Virginia Henderson's nursing theory talks about basic principles of nursing care. So she mentions 14 basic needs every patient needs to do or receive in order to function adequately, and there are also 14 basic nursing cares that need to be provided for patients. So of those nursing cares, she added communication, especially associated with basic needs and feelings. So this is where our theory ties into her theory about gossiping and talking bad about our patients. Whether we realize it or not, the way we talk about our patients to other nurses not only alters our ability to provide our patients the basic care that they need, but most importantly, it affects our line of communication with our patients, and we are not able to fulfill their basic needs and feelings. So communication is one of the key elements to nursing care, and Virginia Henderson taught us that very thoroughly. And in order for us to be the best nurses, we need to have that open line of communication, and we keep that through decreasing our negativity towards our patients. Okay, so now the question, how does this theory help us understand certain aspects of nursing? We have two main bullet points here. So nurses require compassion for their patients. So gossiping affects the quality of care we give our patients because it causes us to think less of our patients as individuals and more of a chore that we have to deal with during our shift. So we need to have that compassion and care for our patients during our shifts and not see them as a chore. Nurses require excellent communication skills. When nurses gossip at work, they tend to lose the ability to communicate effectively with their patients. Even if the patient does not hear what the nurse and other members of the healthcare team are saying about them, each time that the nurse steps into the patient's room to provide cares, she will always have the gossiping conversation running through her head. This will cause her to think poorly of the patient and affect her overall ability to hear what the patient has to say. I'm sure we've all been in situations like this where just being around, the nurse's station and people talking poorly about a patient has changed the way we view them. And the next time we go in, maybe we aren't communicating as well because we don't have that positivity towards our patients. So we need to have that excellent communication skill, and we can do that through decreasing our gossip. Now we're going to see our practice situation. So we're going to see this in theory, in real life. So we have an experience here from a person online that said a patient wrote about an experience online where she overheard her healthcare provider talking about her with other members of the healthcare team. She said that she was frequently in the hospital because of her medical diagnosis. Her healthcare provider saw that she was once again in the ED. The patient overheard her say, "Gosh, she was just in the ER and was just here a couple weeks ago. What does this woman want from me?" That immediately hurt the patient, and she said that she lost faith in her provider. She understood where her provider was coming from, but she could not help but to feel hurt. So taking a look at that, if we could go back to this situation, we could apply our nursing theory, which is, not gossiping, improving this positivity and decreasing the negativity, improving communication. If we were to apply this theory to prevent loss of trust within the nursing relationship, these are a few of the things that we could have done. So once the provider found out that this particular patient had returned to the ER, he or she could have tried to understand that it is okay to feel a little frustrated. It's being human. So we all go through these times with frustrating patients. These are just some steps that we can follow in order to provide better care in this real life situation. So it's okay to feel frustrated. Recognize that frustration. Take a little time before seeing the patient to relax. So just clear your mind. View the situation from the patient's perspective. Resist talking bad about the patient with other members of the healthcare team, and take time to talk with the patient to see how they are feeling. Showing compassion and really listening to the patient will help them take away those negative feelings. These are all just suggestions that can help you be a better nurse. And it would have helped this situation drastically for this. So why is our nursing theory important to nursing? So our patient safety is our #1 priority. We talked about that. We are there to protect our patients and to help them heal. Gossiping can damage our nurse-patient relationship, can prolong healing, and may even lead to harm caused to the patient, which is not what we want. The therapeutic communication helps us to understand our patient and leads to the best care we can give. So we feel that this theory that we came up with is going to just make us better nurses, better caring, and be able to give them that holistic care that they deserve and that we should be able to give them. Anyways, thanks for watching, listening, I mean.